Could you please explain the confusions on the usage of AMH in women for fertility management and fertility planning?
Yes, so in terms of fertility management, so fertility management means that you do not have infertility, you just started trying to conceive. Yeah, so fertility planning is you want to conceive in 3 years, 5 years, or 10 years from now, and you need to plan that future fertility. You need to predict your future fertility. So in terms of fertility management, which means you are starting to try to conceive, you're in relationship with male partner, you're both of you are ready to have a child together, then you started trying to conceive. So there is a myth or confusion which says you don't need to check your AMH, you don't need to even know your AMH, just it's unnecessary. So it's wrong, because looking at the AMH levels, you can actually predict what problems you're going to face if you try to conceive naturally. You may not face any problems, but there are some problems you may face, because let us say when you're trying to conceive, then you shouldn't wait another 6 months or 1 year to find out actually you had some issue, and you should have addressed before you try to conceive naturally, rather than waiting another year to find out, another year of stress and frustration. So IMH's role for that is to tell whether you are actually ovulating, or whether you are running out of egg reserve, which means you shouldn't be trying whole year before you actually find that you have such a low egg reserve. So which means you need to seek help early. Let us say, for example, so just simply looking at AMH levels and knowing your menstrual cycles, you can tell whether you're ovulating or not. You don't even need to do progesterone test, because if you are having a regular period every month, that indicates generally you are ovulating. In order to have a period, you need to release the egg, so that growing egg or follicle produces estrogen that prepares your lining. Then after ovulation, you produce progesterone. Then after progesterone drops, if pregnancy does not occur, then you have a period. Generally, regular periods indication of ovulation. And also, if you look at AMH, if your AMH levels are normal or low, that indicates you're ovulating. If your AMH level is less than 25, if you're having regular period, generally it indicates that you're ovulating every month. You don't need to even check your progesterone levels on day 21. So if your AMH is very high, and if you are having irregular period, very likely you have a PCOS and you are not ovulating. There is no point of trying whole year and finding out actually you are not ovulating, or you may be ovulating every 3-4 months. So just doing a simple AMH test can tell whether you're actually ovulating or not, in addition to your menstrual cycle history. So you track your menstrual cycle and look at the AMH. If your AMH is very high, you're having period every 2-3 months, you're not ovulating. Which means you need ovulation induction straight away. So rather than trying 6 months or 1 year without success. So clomid or letrozole, provided you don't have any other fertility problems, should help you to conceive. And also in other extreme of AMH level, when you have a very low AMH, let us say your AMH is only 2.3 picomole liters, for example, and I don't recommend you should try whole year to find out whether you can conceive or not naturally, because next year your egg reserve will be even lower, critically low. So, and then you just got time limit before you should complete your family. So, and for that, you can try to conceive naturally, maybe for 6 months, and actively start planning for fertility treatment. Let us say you can do it in parallel. You did AMH test just before you start trying to conceive naturally, which is fertility management. So your AMH is low, then start trying to conceive naturally. Then at the same time, see your GP, get a referral to fertility specialist, start chatting with talking with fertility specialists, start making plans, because all this thing may take, depending on where you live, 3 months or 6 months. Hopefully you conceive by the time you need fertility treatment. So, and if not successful, you have got plan B, backup plan. Plan A, natural conception when you have a low AMH. Plan B is a fertility treatment as a backup plan. So if not successful, then you can quickly do fertility treatment. Generally, it's IVF, and then achieve successful pregnancy. So this is why AMH does play important role in fertility management, which means anyone who is trying to conceive naturally should check the AMH levels, check the antral follicle count, do ultrasound scan to ensure uterus is healthy, and AFC and AMH is good, normal, and ensure that you're ovulating before you try to conceive naturally. for fertility tracking, which means long-term fertility, so AMH is very important. It can tell you your future egg reserve. So future egg reserve doesn't tell everything about your fertility, but it tells most critical thing, which means whether you will be releasing eggs in 3 years, 5 years, or 10 years, whenever you're ready to have a child. Let us say you want to have a child or children, but you can't have a child now. So a lot of women in this situation, millions maybe around the world in this situation. So if they don't do anything about checking the fertile egg reserve, by the time they're ready to have a child, they may have run out of egg reserve, or they may have a critically low egg reserve, and they may really struggle. They may need multiple cycles of IVF. They may need to use a donor egg to have a successful pregnancy. So if you do AMH test in antral follicle count a couple of times, you can tell what will be your egg reserve is like when you're ready to conceive. Let us say your age is 30, you want to have a child 30 at the age of 35. Look at the AMH, look at the AFC. Your AMH is 20, AFC is 25. So you can predict at the age of 35, probably your AMH is going to be like approximately 10 to 15. AFC is going to be like around 15 or so, which is good egg reserve. In other scenario, your friend does AMH and AFC at the age of 30, and her AMH is 3.5, AFC is 8. Very likely by the age of 35, when she's ready to have a child, she might have run out of egg reserve, or she may have critically low egg reserve. She may not be able to conceive. Even IVF may not be able to help. So this is why to predict for future fertility or for future fertility planning, AMH plays critical role. This is why we should not dismiss AMH. You don't need AMH, whenever you're ready, just try to conceive. No, 5% of women are at risk of early menopause or premature ovarian insufficiency. You don't know who's those women until you do AMH test. So this is why we need to understand the confusions about AMH test, and AMH plays very important role in fertility management and fertility planning.